And, the thing that people say is that we don't feel listened to at all. Even though the city took a very community-based approach to racial equity, it's not being felt by people, and they don't feel like their experiences are being reflected by the policies.
Welcome to Collaborative Endeavors, a podcast about how scientists from different areas of research come together to tackle big health challenges, leading to better therapies and healthier communities. In this episode, we meet Claire DeCateau, a professor of sociology at UIC who has studied several epidemics over her career. We also meet Ivan Arenas, a cultural anthropologist and architect who serves as associate director at UIC's Institute for Research on Race and Public Policy. His research focuses on how social movements use creative art practices to establish solidarities beyond the state. Early in the pandemic, Dr. DeCateau, Dr. Arenas, and their robust team of interdisciplinary researchers began to interview Black, Latinx, and white residents of 3 Chicago neighborhoods in order to explore how the pandemic has impacted different communities. Drawing on over 150 interviews with residents and policymakers, the team found that while COVID-19 has been treated as a health crisis at the federal, state, and local levels, city residents experienced it as a much broader crisis related to housing, jobs, childcare, schooling, and healthcare.
Often we take an approach in this country wherein the problems are addressed sort of at the end point when people are in acute need, as opposed to really thinking about root causes and root solutions that might actually help support people before they get to the crisis mode. And a pandemic is clearly a crisis, but, the crisis in housing and healthcare and education is pretty acute already in many of the most vulnerable communities of Chicago. And, we aren't attending to that on a day-to-day level. It took the pandemic to really create some of the policies that might start to attend to that, but they really were kind of after the fact, as opposed to being more proactive in engaging with the problem to begin with.
I do think that public health experts have obviously really taken the lead in terms of designing policies to mitigate the effects of COVID, especially on vulnerable populations. And I think that one of the good things about that is that public health experts really come from a discipline that recognizes the social determinants of health. So by that, we mean things beyond just their health status. So things like people's economic conditions, their financial status, the environment that they live in, the neighborhood, and whether their neighborhood has, healthy grocery stores and access to hospitals and things like that. So the social determinants of health are obviously super important for understanding broader vulnerabilities that then make people more susceptible to COVID and worse effects of COVID once it occurs. I think that having public health experts sort of at the helm of policy development for COVID in particular has really led to a leading with data approach, which is in some ways really fabulous because Chicago in particular really took the lead on kind of making sure that we had data on racial and ethnic inequalities in the city, and was really thinking in a great way about how having the numbers on the way that COVID was unevenly impacting racially marginalized citizens was important to know, right? It's important to gather that data. But I do think that the city ended up investing really heavily in its data infrastructure. And in some ways, that investment actually took away from their capacity to invest more in social service provision.
Drs. DeCateau and Arenas talked about the early days of the project and how they drew upon the skills within the Institute for Research on Race and Public Policy, referred to as IRRPP, to not only tap into interdisciplinary research perspectives, but to connect with the individuals and community-based organizations operating on the front lines every day.
IRPP has been publishing state of racial justice reports like this since 2017. And the Institute has been researching racial inequity since the 1990s when it was constituted. The report did come together as a kind of organic response to the pandemic, but it is also true that it's critically informed by those decades of understanding about the long-term pandemics of housing instability, health gaps, lack of employment opportunity, under-resourced education, the over-policing that are realities for the Latinx and Black communities of Chicago well before COVID-19 came along.
So Amanda Lewis, who's the director of the Institute for Research on Race and Public Policy at UIC, he really kind of focused in right at the beginning and put out a call for folks who might be interested in doing research on the social consequences of the pandemic, and especially on sort of untangling what was very obvious very early on, which was the disproportionate impact of the pandemic on racial minorities in the city of Chicago. And so the initial sort of broad call dwindled down a little bit to folks who were really committed to doing what turned out to be this sort of project that looked at both the policy response and did interviews with policymakers and state actors and epidemiologists, and these interviews with residents in the three neighborhoods that we chose, which was Albany Park and Little Village and Austin. And so we also worked with three different research assistants from different disciplinary backgrounds who were amazing and did a tremendous amount of work to really address kind of grounded problems that we were having, for example, with recruitment, because doing interviews over the phone is really trying, and we were having some barriers. Anyway, so they just were great at troubleshooting some of the difficulties we faced. And then we also brought on a huge team of undergrads over the course of a year and a half to help with translation and transcription and summarizing and coding. And then Yvonne worked with a team of folks at IRPP, including Chris Polos and Dina Lewis, to do sort of the quantitative analysis and graphics that brought in these broader patterns that we see in the report as well.
And I would say that an important guiding principle for projects like this at IRPP is that for us, a multidisciplinary team means not only engaging with a broad team of academic researchers, but also working with individuals and community-based organizations that are doing work on the ground and who really know the needs and the ways to meet those needs for our most impacted communities. And, you know, part of a challenge of that is that working with community scholars, working with practitioners on the ground, they're often under-resourced, they're overworked, and university projects are one of the reasons that those communities can be overworked. And so we have to take a great deal of care to do the kind of engaged research that is not extractive and feeds off the generosity and the kind of wealth of resources and knowledge in vulnerable communities, but that can work in relation and in solidarity with those communities to address their needs and to amplify their voices. And, you know, what we know is that living up to this is a struggle for even the most well-meaning of researchers because university systems are not necessarily set up to encourage the kind of engaged research that this takes. So the people we interviewed with for this project, you know, they were very aware and articulated very clearly that the healthcare challenges they were facing were also employment challenges, housing challenges, childcare challenges, and so on. And what becomes evident to us is that the interrelated character of those challenges, you know, it's not invisible to researchers, but our scholarly perspectives are often kind of narrowly focused due to our disciplinary training or due to the kind of demands towards specialization that academia fosters. And so having an interdisciplinary team allowed us to break those silos open and to better engage with the interrelated dynamics of inequities. And that's true not just for this project, but more broadly, right? Multidisciplinary teams are better positioned to identify the tangled roots of racial inequities and therefore also to maybe parse out what are some policies that can offer solutions.
Dr. DeCateau walked me through the study's findings. If you were interested in reading the full report, which I highly recommend, you can find a link in the show notes.
So the puzzle that the report sort of seeks to address is, you know, there was tons and tons of resources that were made available through CARES Act funding and then ARPA, and of course there were different legislations along the way that provided different sets of funding. So there was huge amounts of federal, state, and local funding and resources that were meant to redress the health and racial disparities that were associated with the pandemic. And the city of Chicago really took that on with incredible intensity. You know, that they really took it on as a core kind of value to approach the pandemic with a racial equity lens. And so our question is, you know, given all of that, why is it that those who were already vulnerable prior to the pandemic, those who are marginalized, were the ones who not only felt the brunt of, you know, hospitalizations and deaths, but also, you know, didn't necessarily receive the resources in the way that would have most helped them? And we have answers. as to why this is. So the first is this kind of like larger structural problem, right? So decades of discriminatory policies on housing, healthcare, and Social Security, as well as kind of broader disinvestment in poor communities in Chicago, meant that lower income Chicagoans didn't have a safety net to rely on during the pandemic. And so they didn't have existing sort of financial cushions. Many of them couldn't stay home. They had front-facing jobs. And so that's one of the reasons why they faced the biggest vulnerabilities despite the resources that were being funneled into the city. The second is that COVID-19 was really treated primarily as a health crisis. And so a ton of the funding, of course, went to public health and public health responses. But many of the residents that we interviewed really experienced the pandemic as a much bigger crisis that was associated with housing, food, employment, and childcare insecurity. And so we really found that was a huge lack. The financial and housing security really needed to be prioritized from the outset in order to redress the vulnerabilities that we ended up seeing. So number 3 was just that the COVID response really prioritized middle-class Americans and the protection of the economy over keeping the vulnerable safe. So in many ways, middle-class Americans were able to stay home and stay safe because working-class people continued to work in factories and shipping and meatpacking and agriculture. And then, of course, fourth, there were a lot of problems with the way that social assistance was made available during the pandemic. So I already mentioned how, housing should have been prioritized at the outset instead of sort of waiting for people to experience housing insecurity and then initiating rental assistance programs. But also even once rental assistance and financial assistance became available, they often had so many bureaucratic requirements attached to them that people really struggled to access them. So the numbers are pretty astounding in terms of the level of need for rental assistance versus the number of applications that have actually been approved and paid out. I just think that speaks to this real lack in the way that that social assistance was made available.
Dr. Arenas elaborated.
An interrelated challenge that we saw through the course of this research on the disparities in relation to COVID-19 in Chicago is that there was a general disconnect in the chain of care between those who were making those health policies or making other public policies and how they were implemented at the neighborhood level. So we looked in our research at Austin, Albany Park, and Little Village, and in those 3 communities, we continually heard in interviews that people didn't know where to go for testing in their neighborhood. They didn't know who to reach out to about rental assistance. They didn't know where to go to deal with related issues that public policies were meant to address. And so we need to take care of the systemic barriers that exist, not just in that chain of care in relation to health, but also in relation to housing, education, employment, transportation, and so on. And until we do so, the people in those most vulnerable neighborhoods are going to continue to suffer, despite the dollar amounts in the millions that may be distributed and despite policies that are meant to address the needs of those vulnerable populations.
And, the thing that people say is that we don't feel listened to at all. Even though the city took a very community-based approach to racial equity, it's not being felt by people, and they don't feel like their experiences are being reflected by the policies. And so I just think that literally talking to people on the ground about their experiences reveals so much about not only the barriers, but also what works and what has been really successful and what has not been successful and where the gaps are.
Dr. Arenas outlined what we can do to remedy this situation and better position ourselves for future emergencies at the local and national level.
Clearly, there are some important implications of that work for what we can do as a city and nation going forward. First and foremost, we would want to put in place policies to address the root causes of racial inequities, rather than this kind of reactive social assistance programs that we often get that largely are acting as a form of triage. So that would be, one important thing that we can do as a city. Another thing, though, that I would also note is that, we end the report by talking about how despite the city's pervasive or persistent or consequential racial inequities and the challenges that those produce, we did see that through the pandemic that Chicago's residents do show up for each other and that our community-based organizations remain a kind of bulwark for those that most need it. And so that really does give us hope for the future. But we also know that that hope has to be nurtured by policies that prioritize the needs of those vulnerable families. And importantly, that then end up funding the community-based organizations on the front lines of the struggle for greater racial equity. So we would want to also create effective mechanisms, effective processes for community-based organizations to really be the ones that also are driving policy making, to be the ones that are controlling the power of the purse. And that we think that would also better ensure that Chicago can be a city that works for all, and not just for those that were fortunate enough to have the financial means, to have the kind of accumulated wealth that one would need to weather storms such as COVID-19.
Throughout our conversation, Drs. DiCato and Arenas stressed the importance of community-engaged research and creating space within our academic settings to allow researchers to learn how to collaborate with community-based organizations in a meaningful and symbiotic way.
I guess what I would say is, from my own experience and from what I've seen at UIC, is that in doing that community work, there are new avenues for collaboration, both with other scholars at UIC and even in other universities, that can open up with people in government, philanthropy, the business community, et cetera. That kind of interdisciplinary work that's grounded in community will also sharpen our research theses and analyses. There, is a lot of theory making that comes out through that work itself. So I think there is an academic benefit, as well as what I would say like a kind of moral or social argument for engaged interdisciplinary research. And, no matter what the silos we're in, as researchers, we do have access to resources, to power, and to privilege that can be leveraged in the service of community work. But I think the starting point should be that work itself. Scholars should seek out in a community, an organization who they feel is doing good work, get involved, and find research avenues through that. I think that is something I've seen over the years here at UIC happen very effectively. And at the same time, is something that as more and more researchers do, it becomes easier and easier to do that at the university and to ask for further resources and time to nurture those relationships, because this work is much longer, much harder, but also much more consequential, I would add.
I think some of the organizations that we engaged with and spoke to and have kind of partnered with through this project, a lot of them have done their own needs assessments in their communities and have done sort of a version of like popular epidemiology kind of on the ground. And I think that some of those groups have just found tremendous results from that kind of grounded asking folks what they need from their community. And I think that that's the basis for, in many ways, their establishment of mutual aid funds and their ability to kind of push back against city policy comes from that sort of knowledge of their own community. And in some ways, public health folks, social scientists can really help people in those ways with gathering the data that would be most useful to communities about themselves to push policy forward.
Oftentimes within the silos of academia, it can also be a lonely place and a place where people don't necessarily often feel their projects are understood or heard. And I would encourage folks to reach out to spaces that connect people, that are building bridges both within, departments, within the university, but also out to community. There are many great resources and places that people can connect with others and sort of build the kind of network that make this work something that's rewarding despite the kind of challenges of it.
Collaborative Endeavors is produced by me, Lauren Rieger, on behalf of the Center for Clinical and Translational Science, aka the CCTS, at the University of Illinois, Chicago. To learn more about Dr. DiCato, Dr. Arenas, and the research discussed in this episode, visit the links in our show notes. The CCTS is supported by the National Institutes of Health's National Center for Advancing Translational Science through their Clinical and Translational Science Award. Opinions expressed by guests of the show are their own and do not necessarily represent the views of myself, the CCTS, or our funding agencies. You can find more episodes of Collaborative Endeavors on Apple Podcasts, Spotify, Amazon Music, and Google Podcasts. New episodes drop monthly. While we do not monetize this podcast, we do love positive feedback. If you like what you hear, go ahead and give us a 5-star rating to help spread the word. To learn more about how you can get involved in health research, visit ccts.uic.edu or follow us on Twitter @UICCCTS.